Trailblazers was a compelling message to the Quality Healthcare Network Board. Given our history, it simply was the right thing for us to do to support the campaign and to act as a secretariat for Ontario.
To coordinate the message and support the 6 interventions in Safer Healthcare Now, Trailblazers in each of the local health integration networks were identified and trained to act as regional resources for participating healthcare organizations.
We now have 106 healthcare organizations enrolled in Safer Healthcare Now in Ontario, with over 270 clinical teams. We have trained 28 Trailblazers to act as resource people to teams enrolled in the campaign in each of the LHINs, and we are thankful for the support from the Ontario Ministry of Health and Long-Term Care. On behalf of the Board of the Quality Healthcare Network, I want to extend my warm thanks to the Trailblazers for their relentless efforts.
I was part of that critical mass of energy and knowledge. I know we're far stronger if we support each other and learn together than if we try to do it alone.
It's been an amazing learning opportunity for me. I was at that point where this came just at the right time, you know, like I wanted to learn so much about quality, risk management, patient safety, how to improve the quality of care we give to the clients in our organization. And so everything that this campaign has been about to me has been representative of quality care for the patients and how to improve that.
The interesting feature of the Trailblazer study is that there were many positive examples of connections that happened, but this is really just a first step.
Throughout the 15-month project, the Trailblazers contributed to the growing knowledge about the 6 interventions and best practices for their implementation. The Trailblazers have helped to bridge the gap between current activities and best practice, building capacity and improvement skills across Ontario.
I know in my own organization because 2 things. I know that we're going to actually get MedRec implemented, but also my team that I've worked with for quite a while to get this going told me that they didn't need me anymore because I had taught them well. And for me, that was the best success I could have had. So for the rest of the LHIN, I think seeing more people sign on has really been the indication that things are moving.
To create and sustain a network of skilled resource persons takes a lot more time, resources, and support than this initial first step would have allowed.
I think what is needed, especially in our LHIN, and every LHIN may be a little bit different, is a regional resource for quality and safety. We have quite a number of extremely small rural hospitals, and they just simply don't have the resources or the infrastructure or the expertise in quality improvement methodologies. They have 100% commitment to quality and safety, but they just don't have the internal resources.
Implementing quality improvement and patient safety initiatives in Ontario, like the Safer Healthcare Now campaign, is extremely challenging because of the large scale of this effort. Not only does Ontario have a large population and a vast geography, but unlike other nodes, our healthcare system has only recently started to become regionalized. As the principal investigator for the Safer Healthcare Now measurement team, we collected data on the impact of the campaign, and I can say that the preliminary results from phase 1 of the campaign show very promising trends.
The learning is that, quality is not a project. It's sort of a never-ending journey, and you have to be patient and you have to make small steps to eventually get the outcomes that you want. And it's hard. It's hard to be patient. It's hard to take all the time that you need, but that's what we need to do. And I'm just so pleased that there's a national campaign with regional support through the Ontario node and through the LHINs to help people to make those changes that they want to make.